Hello, my name is Kimberly Litwiller. I'm a nurse practitioner student at Auburn University. Today I'm going to talk about pediatric hydrocele. A hydrocele is a collection of fluid in the scrotum surrounding the testicles, which can occur on one or both sides. The scrotum will look swollen or enlarged, but they are usually painless. Hydroceles occur more commonly in infants, especially premature infants, but can happen at any age. It is estimated the incidence is less than 4.7% in infant males. Predominantly a pediatric occurrence, it is estimated that it affects 1% of the adult male population. During the fetal development, the testicles descend through the processus vaginis to the scrotal sac. After the testicles descend, the PV obliterates. The distal tip of the PV remains as the membrane around the testicles. If the PV does not close, it will allow fluid to move between the abdomen and the scrotum. This is often referred to as communicating hydrocele. A communicating hydrocele is the most common in children. The hydrocele's direct communication to the peritoneal cavity contains peritoneal fluid. Almost always is associated with the indirect inguinal hernia and decreases in size when the patient is in recumbent position. Non-communicating hydrocele does not have a direct connection to the peritoneal cavity. The common causes are trauma, infection, or testicular torsion. It's more common in adults and older children, but can happen at birth too. Risk factors are male, premature, low birth weight, infants less than the age of 6, infants whose testes descend directly late, increased interperitoneal fluid or pressure, inflammation or injury to the scrotum, testicular cancer, or connective tissue disorders like Ehlers-Danlos syndrome. Key questions to ask your patient or parent is: when did they notice the swelling? Has it increased over time? Is your child in pain, or does your child have any other symptoms? This information helps you determine communicating or non-communicating and to choose the appropriate treatment. Since diagnosis is based on clinical findings, the physical exam is important, along with those questions. A scrotal mass will be non-tender and is usually demonstrated on physical exam. The mass is likely to be soft if it is communicating. It may be large or small. It may be restricted to the scrotum, but it may include the inguinal canal. Palpation of the testes is important in order to get an accurate testicular pathology. If there is a hydrocele present but unable to palpate, maneuvers such as crying or raising hands or to increase abdominal pressure can help make it palpate. Transillumination is the important tool in the physical exam of a hydrocele. In nearly all hydroceles, the fluid will be transilluminated when the scrotum is investigated with a forced beam light. Ultrasound can be obtained, but not always necessary since clinical findings can be the diagnosis. The ultrasound would identify structures, and it can identify communicating or non-communicating if that was not evident in the physical exam. The treatment is observation, most resolve by age 2. Unless there is a hernia involved, where there is bowel present, surgical repair is recommended. Aspiration is not recommended due to the fact that it can cause more damage, and they usually reoccur if aspiration is the choice of treatment. After 2 years of age, if it is not resolved on its own, then a surgical procedure is recommended. There are 2 types. They can do it as an open or laparoscopic. The expected outcome after surgical repair is less than 2% of reoccurrence. It is very important for observation to educate your parents on the signs and symptoms of incarceration. These symptoms include vomiting, abdominal pain, and a non-reducible inguinal hernia, if that is involved. These signs are a need for surgical repair. Patients should be educated on how to reduce an inguinal hernia if that is repaired. Thank you.